Chaplin. I'm the Deputy Director of Nursing for Cancer, and I work across Mid and South Essex NHS Foundation Trust. So we cover 3 large hospitals. We are one of the largest trusts within the country now since we've merged, and we diagnose over 10,000 new cases of cancer each year. So we see a large number of people affected by cancer. And we reached out a number of years ago to Beetroot, to the company, to support us with remote monitoring of patients, so to ensure that they're followed up effectively and safely, and ensure that we give a good service to them. We wanted to improve our service, and we've been really fortunate working with Beetroot because they've enabled us to set up a really good remote monitoring system. And that means that it's really beneficial to patients, but also beneficial to our service and our clinicians. And the reason being is that it can mean that patients are not regularly having to come up to hospital if they don't need to. So it means that we can remotely monitor them. We can also send questionnaires to them, which has been really great service. So we can do quality of life assessment, holistic needs assessments. And that means that we can get information really speedily from patients, and also if their results, we can monitor them, and if there's a problem or a concern, that highlights to the nurse specialist, and it means that we can rapidly access the patient and contact them and bring them into clinic. So we're actually seeing them when we need to see them. Beetroot have been really helpful in setting up with a number of tumour sites, which has meant that it's been really flexible. We've been able to adapt it to the needs of the service and the needs of the patient. So we've built the service around them with the use of Beetroot as an IT platform. I think it's made a huge impact on our waiting list. We know that we are having to follow up thousands of people affected by cancer because we're fortunate that people live a lot longer with cancer now. So actually people needing to be followed up, the numbers have increased hugely. And so what that means is with having Beetroot, we can have a number of patients on that remote monitoring that don't need to come up to see oncologists. And that means that we have those that do need to see the oncologist have those appointments readily available. So we have thousands of patients now being monitored on our Beetroot system, which means that enable us to have many more appointments for those with complex problems or new diagnosis that need to be seen urgently. Whereas those that are doing well and are well at home, we can monitor them, and then they're not having to come up to hospital for the results. We can send them a letter or contact them remotely. So Beetroot as an IT platform was originally envisaged to be used for personalised stratified follow-up, so to follow up those patients who had completed treatment and needed monitoring. But what the work that we've done with Beetroot is that we've extended that to include active surveillance. So patients with prostate cancer who need active surveillance prior to commencing treatment, or just that may not ever reach treatment, we're able to use the IT platform to monitor those. And something that we're also very keen to expand on is those with precancerous lumps or precancerous cysts, for example pancreatic cysts. We're very keen to use Beetroot to follow those up that may need to have scans or blood tests to monitor to see if they will turn into cancer in the future. Because that takes up a huge amount of resource and surveillance needs, and actually it's hugely beneficial for patients and for our capacity to have those remotely followed up. So it's not just those with cancer that have completed treatment, it can actually incorporate many aspects of the patient pathway. I think it's been a huge impact on clinicians' time, as well as giving the trust efficiencies by using administrators to monitor the patients safely. We know we have set boundaries that the administrators have to follow and protocols that have been agreed by clinicians. So huge impact to the clinicians' time, and efficiently using staff for the right duties to enable those clinicians, as I said previously, to see patients where there's a real need to be seen. So our service overall at MSE, we've seen a huge impact with using Beetroot Cancer, and where previously patients were potentially being monitored on a database or an Excel spreadsheet, we had real concerns over patient safety, and we wanted to improve that, but not only to ensure that patients were being safely followed up, but also to ensure that they had quality metrics and that we were assessing their quality of needs, assessing their holistic needs, and really driving improvements with our service to ensure that they had swift access when there were results that were highlighted that needed a clinician input. And it also meant that efficiencies were there for the patient. They didn't need to be regularly coming up to hospital. And this has shown that we can follow up a huge number of patients in a really safe manner that actually meets the needs of the patient. It then releases time for the clinician to see patients as needed. And I think this model is just growing across MSc. We're seeing all tumour sites very keen to use the beetroot system to really improve their service. And also, as I said, wanting to expand that in not just patients that have finished treatment, but those that need actively monitoring prior to treatment or with precancerous cysts or symptoms. And so I think regionally we've been showcasing how excellent this system is, and actually I think it could be used regionally to really drive improvements across the board in cancer. I think for us, we do use Somerset as a registry. So when patients are newly diagnosed, they're put onto our Somerset as a register, and we track the patients through Somerset. We found that we were quite restricted with Somerset, that it was something that not all clinicians could access, that it had limited information, and that the system was very rigid. And actually what we wanted was a system that we could actually develop and we could really tailor to the needs not only of the service but the needs of the patient. And that's been hugely beneficial, that we can add on those extra parts with Beetroot of contacting the patient, sending them messages, sending them questionnaires to complete that then comes directly back into our system. And as well as that, with Beetroot we've been able to link in with our other areas that are vitally important, such as endoscopy, as radiology, as pathology, to ensure that all the results are there to safely monitor the patient. So those other systems have been more crucial to us, and having a system that we can develop with the company to meet the needs of the service has been hugely beneficial.